The modern American medical appointment lasts exactly 15 minutes. In that tiny window, a physician has to evaluate, diagnose, and prescribe. To make those calls, they rely on legacy electronic health records. This chart shows what they typically see on their screen, a narrow biological timeline. We have a jagged spike in heart rate sitting next to a streak of red X's, representing missed medications. Looking at this data, a clinical assumption follows. The patient is labeled non-compliant. The doctor delivers a standard lecture about taking pills on schedule. Then that 15-minute window closes. A biological symptom was treated, but the actual human being sitting in the exam room was completely missed. Human health does not happen in a vacuum. There is always a second timeline running in the background, the invisible, daily life of the patient outside the clinic walls. Medical professionals call these the social determinants of health. Notice this second timeline mapping out environmental factors. A sudden loss of housing stability triggers a steep drop in mental well-being scores. This stress paralyzes their capacity for daily maintenance. Look at the overlap. Exactly when housing stress spikes, the missed medication markers begin. As long as healthcare systems remain blind to this social timeline, delivering accurate, compassionate medical care is a mathematical impossibility. You cannot solve an equation with half the variables missing. This data failure is known as the first mile problem. HumanOS fixes it by shifting data collection away from the stressful clinic waiting room and into the quiet safety of the patient's home. It uses an interface called the Sovereign Screener. By utilizing glassmorphism, a translucent UI design style, and a curated color taxonomy that visually groups related health prompts, the system actively lowers the patient's cognitive load. In this private digital space, the patient can honestly log their daily environmental stressors and their WHO-5 index, a standard 5-question screening tool used to measure current mental well-being without the fear of judgment. Because mental health data is highly sensitive, Aura employs a zero-knowledge architecture. Data nodes are mathematically locked inside a local vault directly on the patient's smartphone. Visually severed from cloud servers, the information is never sold to data brokers or exposed to a central database. True patient honesty only surfaces when absolute digital privacy and a calming environment replace the anxiety of a 20-minute clipboard delay. Once the data is locked, Aura operates within a strict regulatory boundary. It acts exclusively as an information summarizer. It organizes the patient's records, but explicitly refuses to generate medical diagnoses or prescriptive advice. Instead, it relies on timeline integration. Multiple data streams, heart rate lines, pill icons, and mood gradients weave into a single unified band. By highlighting clusters where a low mood exactly intersects with missed pills, the system generates clear visual warning flags for the patient. Aura takes fragmented, invisible human struggles and translates them into a structured, highly legible data language that the medical system can actually process. When the patient returns to the clinic, traditional waiting room paperwork is gone. Instead, they simply hold out their smartphone, displaying a high-contrast QR code. This is the instant intake bridge. The doctor scans the patient's device to initiate a secure, direct data transfer. It requires zero complex IT integration with the hospital's existing network systems. As the laser line scans the QR code, the thick, unified timeline band instantly unpacks onto the doctor's desktop monitor. This entirely bypasses the fragmented silos of legacy electronic health records. This frictionless transfer shifts the burden of recall away from the patient, placing unalterable context into the physician's hands. With both timelines visible, biological failure aligns perfectly with the social one. The housing crisis and plummeting mental health scores directly explain every missed medication marker. The clinical response shifts instantly. Instead of a generic lecture about pill compliance, the doctor prescribes a targeted mental health referral and connects the patient with a social worker. Injecting this context into a fractured system allows the clinical visit to target the root cause of the patient's decline, democratizing mental health data. By structuring the invisible variables of a patient's life, HumanOS builds a technological environment where the data finally reflects the human, making compassionate medical care the standard rather than the exception.